Well, as Australia's vaccine rollout lags, other countries are excelling in theirs. Israel has been a model for the rollout since the beginning. More than half its residents, so far 5.3 million, have been vaccinated. So what can Australia learn from Israel? Joining me now from Israel is Dr Nadav Davidovitch, epidemiologist and public health physician at Gurion University. Doctor, good morning. Thank you for joining me. Is Israel now at a stage where it is reaching herd immunity?
Almost. We actually now celebrating our Independence Day. I just came back home and it was amazing to see people are back on the streets, restaurants. We implemented the Green Pass, and although we are not yet into herd immunity because we're still waiting for the approval of the vaccines for children, I was today in a discussion with the Ministry of Health about that. We are waiting to see the approval by the FDA of those who are 12 to 16. But otherwise, especially because we vaccinated more than 90% of those who are 50 and above, we see also the indirect effect, and Israel is almost back to normal. We implemented the Green Pass, as I said, also for people that are recovered, and also those who are doing tests, rapid tests. So I think it's a proportionate measure, and this is mainly for, going to the theater or sports events. Otherwise, for other places, we have what is called the purple standard in order to have an ethical measure. I really hope that we can get also vaccines for our Palestinian neighbors, because finally we cannot get into herd immunity in our region. We are not an island, and this is something that is important both on moral accounts and also from Israel interest.
So you're almost back to normal, as you said, in Israel. The majority of the population has pretty much been vaccinated now. Why do you think that the rollout has been so successful in the country?
So there are several factors. One, of course, you need to have the provision of enough vaccines, and with Israel secured quite early the vaccines, and this was mainly because of the Ministry of Health negotiating. Israel also had a very good relationship with different vaccine manufacturers, especially with Pfizer, that it was decided that Israel will become a model for other countries. But then we have also the National Health Insurance Law with 4 non-profit health funds. We have in Israel vaccination by nurses that were easier to deploy from other parts of the healthcare system. And third, we invested quite a lot of energy in fighting fake news. There are lots of initiatives by the Ministry of Health, but also bottom-up initiatives by different communities, by municipalities, adapted and tailored to different cultural sectors. There were some problems with the ultra-Orthodox community and some of the Arab population, but in the last few months, things improved dramatically. We still have about 1 million people, and I'm especially concerned about 250,000 that are above 50 that are still either hesitant or resisting, and we still continue to have a campaign, and again, preparing also for vaccination of children age of 12 and above.
Well, it's certainly been an extraordinary effort. What do you think that other countries, for example, Australia, can learn from Israel's success?
I think the most important factor is to have an integrated system to call all the different stakeholders, including pediatricians, family physicians, and to create a trust in the system, to be very transparent, and also to be flexible enough and to have some of the system being decentralized and adapted to the different localities. You cannot have one size fits all, and especially probably in a country like Australia, where you have different regions, you need to adapt to the existing systems, and of course to have enough workforce. But investing in the social media and fighting fake news, that's something that is also very important, but tailored to the different communities. And trust is probably the most important one, including addressing minorities and other groups that maybe have some history Any country has its own history of mistrust, and this should be addressed with community leaders.